Thank you, Emma. I'm just going to adjust the mic slightly. I think I'm a little bit taller than you. Not quite shorty, but not exactly tall at the same time. Good afternoon, colleagues. It's an absolute pleasure and honor to be here at this Civil Service Live event for the first time. I don't have a joke up my sleeve, so I'm not going to pretend to make fun up on the spot. But we were trying to work out how many people are we going to have tomorrow, do you think? And we couldn't actually guess. We came up with different numbers. Some of us, I said, maybe it's just a small room, 10, 15 people. It's not going to be the main auditorium. There's going to be thousands of people. But I'm actually impressed to see so many of you that have come to listen to us. So thank you so much for that. Really do appreciate it. So as Emma introduced me earlier on, my name is Mamun. I work as the program manager at the Asian Resource Center of Croydon. I've been with the organization for a long, long time. And in that time, my role has kind of changed over and over and over again. And when you work with an organization for that length of time, I think what tends to happen is that you take on more or less everything, all the functioning of the organization. But thankfully, we have a large team of staff that I can delegate a lot of my duties to, but where I'm focusing more on the operational governance, marketing and comms, finance, to list a few. Okay, so I'm going to try and multitask. I'll try to remember that to change the... Okay, so I would like to take you through a couple of case studies, starting with a project we ran called Here to Talk, which is currently called Unfolding Layers, which you will find out the reason why later on. This is one of our mental health projects. The project is all about building trust. Trust through culturally responsive mental health support. Here to Talk was a project that was delivered by ASCC to address a massive gap in cultural appropriate mental health support, especially among South Asian communities in our borough, Croydon. Mental health is deeply stigmatized in many of our communities, and mainstream talking therapies often fail to meet people where they are. We work closely with local GPs and NHS to receive referrals and provide counseling in environments that felt safe and familiar. Instead of forcing people into clinical spaces, we delivered sessions through community hubs, faith centers, and even WhatsApp support groups. We also trained mental health champions from within our own community. People who could speak the language, understand the family dynamics, and spot signs of distress early. This peer-based model helped us reach over, 33,000 people. I'll repeat that again, 33,000 people in 3 years, through awareness events, one-to-one sessions, as well as workshops. So what's important here is the outcomes. Participants reported increased emotional resilience, improved relationships, and a stronger sense of agency. One woman even told us that mainstream therapy had failed her because it did not understand her experience. As a mother-in-law living in a multi-generational household, our culturally tailored counseling service helped save her marriage and her life. The success of this project was not about flashy innovation. It was about trust. Trust built through cultural competence, community partnerships, and consistent delivery. And that's something I think the civil service can learn from, especially areas like mental health, safeguarding, and health inequality. Although the Here to Talk project was initially came to an end due to lack of funding, its impact was impossible to ignore. The outcomes improved well-being, reduced stigma, and stronger community resilience was clear. And so was the message from the community. This model works. In response, Public Health Croydon, working closely with the NHS and voluntary sector, recognized the value of this grassroots approach. As part of their counseling in the community strategy, they have now funded ASCC to continue delivering the counseling element of the work unfolding layers. That is what trust can lead to. Not just recovery, but renewal. When agencies come together in true system partnership, not just coordinating, but co-owning solution, the result isn't just better services, it's lasting impact. Built on shared purpose, mutual respect, and genuine commitment to the communities we serve. Remember to change? There we go. So another case study is the Abundance Project. The project is part of the UKRI's Mobilising Community Assets to tackle health inequalities program, which aims to tackle deep-rooted and long-standing health differences in Britain's poorest communities. This includes exploring how UK's community assets, such as museums and parks, can be integrated into healthcare systems with the aim of reducing health inequalities. The Abundance Project is a collaboration between the arts, health sectors, and community organizations. This was to create opportunities for everyone, no matter what their background, to feel included and supported with their mental health. The project sets out to address the unequitable differences in mental health care for different ethnic groups. It supports the abundance mindset, recognizing the many skills, abilities, and resources that already exist in these marginalized communities. The multidisciplinary research team is using a community-based led approach. They're working with 5 community research hubs and lived experience experts from these communities to make sure that the project reflects participants' real-life experience. So what do we know about trust from the findings? Firstly, negative experiences can lead to mistrust of statutory providers and instill hesitancy to use and engage with public services. Competitive and short-term focused funding environment risks communities feeling let down again and again. Constantly changing service landscape makes it more challenging for communities to navigate the system and build trust. Build trust with service users. Target-driven culture in service delivery fails to take into account the organic nature of social connection. Time needed to build rapport, trust, and relationships. Lack of cultural awareness and sensitivity in service planning, design, and delivery can have a negative impact on the experience of diverse communities and service users. Lack of appropriate engagement with communities to assess needs, plan, and deliver services. One-size-fits-all approach not working. Especially young people feel overlooked, not valued, and not listened to. Trust in information sources is a significant factor influencing whether people use or act upon information. The source's trustworthiness, for example, the format, hard copy, virtual, etc., and the relationship with the source all play a role. People are more likely to trust information from sources they know and trust, such as friends and family, or from those within their close community. Conversely, there is skepticism towards information from less familiar sources, particularly online, due to concerns about scams and exaggerated claims. The trustworthiness of information also depends on the topic. Social media is considered a rich source of information about events or local happenings, but not for serious matters. Even with trusted sources, verification may be needed, especially for transactional information. In some communities, there is inherent skepticism towards outsiders and their intentions, and outdated information erodes trust. Conversely, a supportive community can help bridge information gaps by providing contact details to relevant individuals within a trusted network. So these were just the couple of case studies that we wanted to highlight. So we hope that you found some of these points helpful and insightful. So I'll invite my colleague Ima to come back and take the mic, and I'll lower it for you a little bit.
Thank
there we
you.
go. And I'll